Well, we're glad you're joining us for another session of Tooth Talk with the Dental Diva. Dr. Sylvia's here from Jasper Dental Associates. Good morning.
Good morning.
How are you doing today?
I'm doing well, thank you.
And today, I believe we're going to talk, let's see, we've covered pediatric preventative and care. We've covered tooth loss and gum disease. And today, we're going to look at repairing and restoring, and more specifically, fillings.
Yes.
For today. And they've come a long way.
They have, and continue to develop. Most everybody's familiar with amalgam fillings. Those are the silver.
The ones we were stuck with as kids.
That we got when we were children.
Yes.
And those are still, it's a very good, inexpensive material in most cases. But we have developed tooth-colored materials, and most people prefer now to have something that looks natural. So when we do fillings now at Jasper Dental Associates, it's 99.9% of the time it's a tooth-colored filling material.
Because I know the silver, even if they were in the back, you're laughing, opening your mouth, they were still visible.
Exactly. They would often look black.
Right.
Dark.
Now, they lasted forever.
And they still do.
And they still do. But they just weren't pretty.
No, they weren't. And there were some other issues, too. With the new materials that we use today, we can actually keep the filling prep, the way we prepare the tooth for the filling, smaller or more conservative, saving tooth structure and keeping your teeth stronger.
So in other words, y'all don't drill out as much
Correct.
as you used to.
We don't have to remove as much. We can isolate it to that tooth structure that has cavity or decay.
Oh, well, that's good. That makes everything smaller.
Right.
Like smaller
Whereas
fillings.
silver fillings had to have a mechanical lock built into them so that tooth structure was cut out to create this and would cause greater weakening of the tooth.
Okay, so they had to take out more because of the type of filling.
Correct.
For it to stay in.
Mm-hmm. So now we can confine it in some cases to simply the grooves of the teeth. And you'll hear parents talk about dental sealants for their children, because when we have a child with a new tooth in the mouth, first molar on the bottom, we suggest that the tooth is sealed, which means a flowable tooth color material is placed on and into the grooves of the tooth. A bright light is shining on it, which causes it to harden, and it seals the tooth off from bacteria. But it has to be replaced frequently, because children chew ice and do other things that cause it to break off.
Right.
But that's your least invasive manner of protecting the tooth. And then if we see decay, discolored tooth structure looks and feels soft, we can keep it very small in the groove of the tooth and then flow another tooth colored filling material in there.
Now I want to address again, and I think we actually addressed this in the show about the pediatric dentistry, but how important it is to save those baby teeth. Even if they get a cavity in them, don't just think, oh, it's just a baby tooth.
Correct.
If it rots or we just pull it or whatever,
Baby
it has
teeth
a
are
purpose.
Important. Absolutely. They're important to hold the space for the next teeth that are developing, and of course to help the children have a good diet and health from nutritious food. So they're very important, and if they harbor bacteria from decay, it needs to be cleaned out, removed and filled, much in the same way that an adult tooth is filled.
And pulling it too early causes crowding, teeth shifting, and all that stuff, because it is saving the spot.
A position problem for the rest of the teeth. Yes.
Right. Now, like I said, I just wanted to address that because that is so important. Because I've heard so many people, oh, it's just a baby tooth.
No, they're important.
Yeah, they're very important. They're saving space for those mature teeth that are coming along later.
Mm-hmm.
All right, now the basic procedure.
In most cases, you'll come to the office, have a local anesthetic, which will make your tooth numb, and sometimes the whole area of the teeth, and using a drill, which nobody likes the sound of.
No.
We remove the decayed tooth structure, clean it, and then we use a mild acid that actually cleans the surface of the tooth and enamel. And we have another component of the white or tooth colored filling is called an adhesive. So it's brushed on. It helps decrease sensitivity after fillings. And then incrementally, a white tooth filling material called composites, or composite, is placed in the cavity, and it can be a putty-like substance. Now we have more viscous, if you will, materials that can actually flow. We use a carpule and press it into the tooth, and it flows into the space that we've created. And we cure this again with a bright light, and do it in increments to layer the tooth as we're filling the material.
Okay, so the newer tooth-colored stuff is done in layers.
Yes.
You put a little bit in, let it kind of set, put more on top, and then do the light and let that set.
We harden
and
it
so on and
in
so forth.
increments. It's
Okay.
better for the tooth that way.
So it's hardened from the inside out,
Yes, it
as
is.
opposed to just putting the whole thing in and.
There's a tiny bit of shrinkage that goes along with this filling material, or these materials, and we're trying to limit that. And so if you fill it in small increments and cure it with the light to harden it completely, the shrinkage is less. Even though it's micro shrinkage, it doesn't tug on the tooth structure and cause sensitivity as much if we take it in little bits and cure and harden the material as we go.
And not as likely to come out
It,
later on.
the seal is better, but the seal is also dependent upon a couple other things, like keeping the field dry.
As you're
why
doing
we're
the
putting cotton
procedure.
in your
keep
mouth.
it-
Nobody
Right,
likes cotton in the
and-
mouth, but yes.
And the suction hoses and all that
All of
fun
that.
stuff. Yeah. Well, that's interesting because I did not know. You think about the mouth is always wet, so you don't think about having to really dry, keep that surface dry to
Right.
make it adhere.
Now, you can use a dental dam or isolate with cotton, and there are other devices that we can attach to our suction system called an isolator. I can't recall the brand name offhand, but it can wrap around the teeth and keep the field isolated and a bit drier.
Now, what is maintenance on fillings? Just irregular dental,
Regular toothbrushing and flossing, which
so
is
nothing,
important for everybody.
nothing different, nothing special,
They can,
just the same.
They can take on a little stain, and what I tell everyone is that if they notice anything, to let me know so that I can polish it. That is, it is a filling material, and it will degrade. It doesn't last forever. Nothing we do in dentistry truly lasts forever. So we're always maintaining the work that we've done, and that's why it's so important to keep coming in for checkups, even though you've had all of your fillings done, then have no more active cavities. It's important to be, keeping an eye out to make sure they continue to be sealed and functional.
Again, the discoloration you were talking about mainly happens just on the surface, and you can just kind of polish that off.
On the
and-
surface, around the edges, where the tooth structure and the filling material meet, sometimes stain is taken on. I mean, we drink coffee, red wine, and people have other habits that might contribute to staining, but I always let people know that if they see any sign of it, just tell me, and I'd be happy to help polish it off. Or sometimes a modification has to be made in the filling, but it's maintainable.
Okay, and now lifespan of these fillings in comparison to the old silver ones.
As the materials progress, I'm seeing a lot of them looking good years after they've been placed. So I would have to say, on average, 5 to 10 years. But it could be longer.
Right, so you need to, well, as you said, need to come in for your regular checkups and let you
I'm sure
keep
some of us
checking
have
on those.
silver
And
fillings from when we were children, and they in fact still last. But the larger the filling, the less likely of good wear with time, because the materials aren't made to withstand our normal chewing. And the larger the filling, the weaker the tooth then becomes. And that's when we go to another restoration called the crown, if we've lost a lot of tooth structure from decay or wear and tear.
right. And now, would you recommend, after you have these fillings done, maybe not chewing the ice so much anymore, not eating the hard candy, which I think you recommend that in general. But will that take a toll on that more so than
I
And
think
just regular
anytime
wear.
that you've lost some of your natural tooth structure, it is more vulnerable to habits that you're describing. In particular, ice chewing, which can be a sign, if you're craving ice, that you have an iron deficiency. So if there are any ice cravings out there, please beware that it might be that you're low in iron.
I did not know that.
This habit of ice chewing, it increases or decreases the temperature of the tooth, and so it's contracting and expanding much like a wall of a house. And over time, it really stresses the tooth, and we see a lot of damage from ice chewing. Even with otherwise healthy teeth that don't have any fillings, it can cause a tooth to split down the middle.
Wow, so the temperature itself in the chewing of ice is really bad for it.
Mm-hmm.
And not just the hardness, but the temperature itself. Well, that's interesting. See, I learn a lot of things from you. And I was responsible, my grandchildren, for about a year lived with me. And he has some problems going on. And of course, they have told him no chewing any ice, no hard candy, which they basically told him no candy because his teeth are very prone to decay.
If you're prone to decay, it's important to eliminate as much sugar in your diet as you can. And I know you'd asked me on a previous occasion about a healthy sweet product, a pie, a home good. But it's still sugar.
It's still sugar.
Anytime, and in fact, there are sugars that we don't think of, like pasta or bread, that break down as sugars.
Mm-hmm.
And if you allow that to stay on the tooth, it can also contribute to decay. So if anybody has a tendency to get cavities, now you can get a cavity on the smooth surface of the tooth. You can get a cavity in the grooves of the tooth. Different bacteria cause these cavities, but they all use the food substances or sugar that exist in the biofilm that's the sticky like plaque on your teeth. So it's always important to mechanically remove this. Controlling diet, of course, is what you can do to help make things better.
Well, yeah, that's not easy to tell a 7-year-old boy, but we've tried to watch
Halloween,
him.
we get it.
And right, and he did have to have some work done on some baby teeth and stuff like that.
Now,
but yeah,
I will comment on children's dentistry here for you. We see children at Jasper Dental Associates, and almost all of us have our own children. So it's something we like to be as a family practice. But if a child is so young that we have a hard time explaining to them what they're doing, and in other words, it becomes a bad experience for them, we refer them to a children's dentist who help them with sometimes a little children's sedative, help them relax, and then do all the fillings that they need at once. And at that point, they can come back and see us for checkups. But we do try to make it a great experience so that there's no fear the rest of their life from the first experience they've had at the dental office.
they terrified him. His first one just kind of went in off full force, and I think he just felt like he was being attacked by about 3 people, and they were making crazy noises and putting shots in his mouth. And it took us 2 more trips really before he calmed down. I mean, he was just terrified. So that's very important. And another thing I want to stress: parents, talk to the other people in the family. Anywhere where this child spends time, if you are prone to decay, talk to them. Please don't let them have the sugars. Please don't let them have the sodas. Because if they're getting it everywhere else, then all your efforts are just kind of going out the window.
And make sure they're brushing their teeth.
Yes, other people make sure they're brushing their teeth. I can only control what he does at home. And it's out somewhere. And you were talking about the pastas, and I want to address that as well, pasta and potatoes. And it's kind of always been my feeling, anytime you can actually feel after you eat something, and you feel that stickiness on your teeth and that film,
That's right.
that's telling you that that's got stuff in it that...
If your teeth feel like they're wearing fuzzy sweaters, they need to be brushed and flossed.
Yes. And
should
whatever
feel
you
like-
ate was probably just packed with carbs or something sticky, something sugary, bad for the
They
teeth.
should feel like marbles.
Yes, nice and smooth. I think I've said this before. My mother's thing was I got to go brush my teeth. They're wearing sweaters. So if they feel like that, that is definitely a bad sign.
It's time to brush.
Yes, time to brush. So for all your dental needs, whether you be, from the first tooth to the last, Jasper Dental Associates can handle your business for sure. They're a family practice, And Dr. Sylvia is going to give us the information, location, and phone number.
We're at 938 West Church Street in Suite 104, and our phone number is 706-692-2611. Give us a call.
They are a great family practice, and make sure you tune in here every Saturday at 2 o'clock. And she'll be giving us lots more of great advice, helpful tips, stuff we don't know, because she certainly taught me a lot of stuff already. So join us again next week for Tooth Talk with the Dental Diva.